Good morning. So nice to see you on this chilly day. As always, we hope that you are smiling. Hopefully you're somewhere nice and warm as you watch 3+U. Hopefully also you're feeling good. It's no surprise or secret that so many of our friends and family probably have been battling some pretty yucky stuff of late. So good news for us. Dr. Luke Maxfield on the show. He has Aspire Dermatology and Skin Surgery Center. Good to see you.
Thank you. Good to be back.
So here's the thing. Whenever Luke is here, he just kind of comes in. He's this casual person, kind of low key. I have these topics to discuss. So today's topics, germs, how to stay healthy, because Luke's been doing some traveling. So he asked me, where have you been? I've been around Cleveland, North Georgia, doing some interviews. I said to Luke, where have you been? Where have you been?
Yeah, I was in Bulgaria last week or this weekend, so that was a big, quick in and out trip.
A little bit of a travel, kind of a different, but the truth of the matter is, I guess whether we are going to Bulgaria on a plane or if you're just doing your grocery shopping, this is a germy season. And some people, I'm guessing you're going to take me here, have different reactions to different types of products that you put on your skin, so you're going to help us know where to go.
Exactly. Now, so the question is, like, why would a dermatologist care about this? Because you know, I do care about germs, even though I work mostly with the skin, but everyone is using hand sanitizers, everyone's washing their hands, and I see a lot of destroyed hands as a product. I mean, we've all seen it, flu, COVID, whatever virus infections are going around, half the city seemed out at all times over the last couple of months. And so naturally, when we're going to Walmart, we don't want to touch the buggy, we maybe get the wipes, but all of these things can be damaging to our skin, even if they might help prevent hand to like face mucosal transmission of these viruses.
Okay, because it's alcohol based, is that why?
That's one of the reasons, yeah. So alcohol-based sanitizers being the most common that we've seen really in abundance. Those do strip the skin as they evaporate. Even soap and water, as effective as it is, that repetitive washing is one of the most common reasons for what we call hand dermatitis, where the hands are cracked, dry, flaky, painful, split. And if you have it, you know you have it. It is extremely disruptive.
You know, I mean, washing dishes. Actually, here I go with my Christmas gifts again, because I got snail mucin, you know, for Christmas, thanks to you. I had asked for rubber gloves. I did not get them. But I really need to go get myself some rubber gloves, because the water in my kitchen sink gets really, really hot. And yeah, my hands dry out bad.
Yeah. Now, and even some real conversations I have with people, you know, people have like OCD or like this compulsion to over sanitize, and it really does just destroy their quality of life. And as a spin of that, I found this ingredient years ago, and thankfully this is like the solution to almost all of the problems. Here we of course have, I'll leave it here so the camera can get there, but an alcohol-based sanitizer. We all know it, we smell it, we're familiar with it.
Yep, in every office around town.
Yeah, every office. Behind it though, this bad boy, this is hypochlorous acid. It sounds scary, but it's actually a very weak acid. It's actually more skin neutral in terms of pH. It's much more closer to our skin pH than a lot of other ingredients. And not only is it safe for the skin, it's extremely effective. Even during the initial times of COVID, there were studies showing how efficacious it was at preventing the transmission of that. Bacteria, viruses, but again, because it's pH balanced, because it doesn't burn, sting, and strip your skin, it's really good for routine use.
So is this purchasable in store?
Yeah, and the nice thing too is it became viral this last year in 2024, which on social media, that means that like it garnered widespread attention. And that's actually a good thing in this case. So I'm gonna use this product, and I actually have a cut on my finger, you can see there.
Yeah.
Because if you have kids, you know, when you put sanitizer on them, it stings.
Yes.
We've all experienced it. This feels like water, nothing. You can spray it on your face.
Spray some on my hands, will you?
Absolutely.
So then do you rub it in?
Yep. It's a leave-on sanitizer. You rub it in, it feels like water. It's not that expensive.
And there's no odor to it.
Yep. If anything, you get like
I don't smell anything.
Slight chlorine smell. But our bodies actually use this ingredient in our neutrophils, which is a part of our immune system to kill these organisms. But again.
Okay, that's crazy to me because my hands have been a little bit dry. And when I saw you spray it, I thought, oh, it's going to just be like water, but it's not. My hands feel a lot smoother now.
That's good. That's good.
They do yours?
I guess so. I mean,
It just feels hydrated.
It is hydrating.
I guess.
Yeah,
That's
it's amazing
word.
for your skin.
Also, this is beneficial, I would think, especially in an office setting, because some people are very sensitive to smells.
That's true. Yep, no fragrance.
This is kind.
Very kind. We studied in eczema, atopic dermatitis. So if you're looking for a simple one-hack solution for clean, sanitized skin, if we're going throughout life, highly, highly recommend this.
Oh, so like if you work outside, this could help with windburn.
No, because there's no
No.
bacteria associated with that. You're really just trying to kill organisms that would infect you
Oh, I
with
see.
this. It's a sanitizer through and through.
Okay, I do know that you like to come and talk about what you can do to help people, but you like to kind of give shout outs to folks too. So you had an event, was it January?
Yes.
That you had, like, you continued the Christmas celebration into January?
Yep, our Christmas lights were left up a few weeks too long, and to celebrate that, we had a community event late for Christmas party. And I just wanted to say thank you to the Saudi Daisy community. We opened the doors at 5, parking was full at 5:05. We had, I think, 2,000 products to give away, and we gave away all of them except for maybe 50, almost ran out of food and closed the doors at 7. But it's just a testament. I know the last time when I was talking about the subject, I said Saudi Daisy is just an incredible community, a true community, and they showed up, showed out, and it was just a wonderful blessing to have that.
I think I've made this analogy with you before, but you do sometimes remind me of that Michael J. Fox movie, Doc Hollywood. Remember that movie? Because, I mean, you've lived in bigger places. Clearly, you're traveling all over the world, and yet you've chosen Saudi as your community, and you've totally embraced it, and they've embraced you. And we're really glad you're here.
Oh, well, thank you. I appreciate it.
And what's this called again?
So, hypochlorous acid. Brand doesn't matter. They should all be under $20. Inflation has hit this too, but
Hypochloric acid.
Hypochlorous, yeah.
Hypochlorous acid. Here's where you'll find him. It's Aspire Dermatology and Skin Surgery Center in Saudi Daisy, 712-9301, AspireDermatologyTN.com.
Everything is so expensive these days.
Not everything. Budget Breaks will fix your brakes for the best price in town and give you a lifetime guarantee.
Budget Brakes. Brakes starting at just $100.